Hello everyone and welcome to another video of our Facts Only series. Today's video is on anti-obesity medications, actually FDA approved anti-obesity medications. So let's get started. I'm Dr. Mohammed Tinawi. You can find more about my background in the description below. Now, first, we have to define obesity. Most physicians still use body mass index in kilogram per meter squared, and obesity is defined as more or equal to 30, okay, for most populations, and can be class 1, 2, or 3. Some prefer waist circumference in centimeters, so over 94 centimeters in men, over 80 centimeters in women is considered obesity. Now, in addition to diet and exercise, we can consider anti-obesity medications when we have body mass index of 30 kilogram per meter squared, or if it is 27 plus a major weight-related condition such as type 2 diabetes, hypertension, obstructive sleep apnea. So now here are the medications that are FDA approved for the management of obesity. The first one is Orlistat, and it can be over the counter, and it's called Ally or Xenical when it's prescription. The difference between the two is the strength. Now, what is the mechanism of action? Well, it inhibits intestinal lipase. The dose is 60 milligrams 3 times a day if it is over the counter, and double that, 120 milligrams 3 times a day when it's prescribed. It's cheaper to get it over the counter, $50 a month versus $280 a month. It's modestly effective, so of initial weight you can expect about 5% weight loss. Side effects are important and can be really inconvenient to patients: oily stools, fecal discharge, etc. Because it affects absorption in the intestine, patients should take a multivitamin at least 2 hours from the dose to prevent deficiency of fat-soluble vitamins, and those are A, D, E, and K. On this playlist, you can go to these vitamins and know more details about them if you wish. Now, patients with kidney stones, with malabsorption, those who take medications that are dependent on reliable absorption, like thyroid medicine, L-thyroxine, warfarin, which is a blood thinner, or immunosuppressant medications, we have to be careful and follow the level like INR or TSH, free T4, etc. if we can. The second medication is bupropion naltrexone, or Contrave. So this is a combination of two medications. How it works? Well, it inhibits neuronal uptake of norepinephrine and dopamine. This is the role of bupropion, and the negative inhibition, the negative feedback loop on bupropion, this is the role of naltrexone. So this is where the effect is enhanced. The starting dose is 90/8 milligrams, and it's gradually increased to 360/32 milligrams. The cost is substantial, $100 to $515 a month. The efficacy, well, the same like with the previous medicine, about 6% of initial weight. It can cause nausea, dizziness, change in bowel habits, and insomnia. It should not be used in anyone with seizure disorders, someone with end-stage renal disease, dialysis patients, someone with an eating disorder, someone who has problems with the opiate or alcohol use. The next medication is a combination of phentermine and topiramate, or Qsymia. Now, I should say that phentermine is used a lot for weight loss for the short term, but it should not be used for long term. So for long-term use, we can consider this combination, phentermine and topiramate. Now, it's a sympathomimetic, which is the phentermine part, and the CNS activity and dysgeusia is the effect of the topiramate. Now, the starting dose is 3.75/23 milligrams, and it's increased gradually. The maximum dose, or the full dose, is 15/92 milligrams a day. It costs $100 to $160 per month. Now, the efficacy is better than the previous two medications, so 8 to 10% of initial weight. Now, women of reproductive age should not use this medication without a reliable contraception. Now, common side effects include paresthesia, change in taste, dry mouth, constipation, insomnia. It should not be used in someone with uncontrolled hypertension or tachycardia, someone with closed angle glaucoma. If someone is on another stimulant or has history of stimulant misuse, should not be used because of the phentermine. Anyone with kidney stones or nephrolithiasis, serious cardiovascular disease should not use this combination. The next medicine is liraglutide or Saxenda. The mechanism of action, this is a glucagon-like peptide 1 receptor agonist. The starting dose is 0.6 milligram a day, increased to 3 milligrams a day. So this injection, okay, should be used daily. It's very costly, $1,300 to $1,400. It is effective, so 8% of initial weight loss, but like this medicine and the next two medicines have the same side effects and precautions. So I'm just going to say that here, and I don't need to repeat myself with the next two slides. So GI side effects: nausea, vomiting, constipation, diarrhea, dyspepsia. It should not be used in anyone with medullary thyroid cancer, family history of multiple endocrine neoplasia type 2. I have to say these two conditions are really rare. And anyone with a history of pancreatitis, which is not rare, we should use it with caution in anyone with chronic kidney disease and those with GI motility disorders, because most of the side effects are GI related. The next medication is semaglutide, Wegovy. The full dose for weight loss is 2.4 milligrams. Ozempic is the same medicine, but it's used for diabetes. This is probably the most famous of weight loss medications. It is also a glucagon-like peptide 1 receptor agonist like the liraglutide, but it is given once a week, so it's more convenient. The start should be very gradual, so you start with 0.25 milligram a week and you increase very gradually to 2.4 milligram a week. It's very costly, about $1,400 a month. It's very efficacious, so 15% weight loss of initial weight. Side effects are similar to liraglutide. Last is tirzepatide or Zepbound. It has dual action, so glucagon-like peptide 1 agonist and gastric inhibitory peptide agonist. The starting dose is 2.5 milligrams a week, so this is also a weekly injection, and it is increased to 10 to 15 milligrams per week. The cost also is substantial, $1,000 a month. It's very efficacious. Of all the medications, you can expect probably most weight loss with this medication, 20 to 22% of initial weight. Side effects is the same for the liraglutide and also for the semaglutide. I hope that was helpful. Please like the video and subscribe to the channel.